in South Australia, we've seen that hospitalisation number plateau at 123. So it's levelling out the hospitalisation at 123, so slightly down on the day before. We still unfortunately have 12 people in ICU in South Australia and one person who remains on a ventilator. So no change to ICU and the ventilator, a slight reduction in those hospitalised and a slight reduction also in the new cases in South Australia. Pleasingly, in the Women's and Children's Hospital, we still have no patients in ICU. In fact, we haven't had any patients in ICU in the Women's and Children's Hospital. We were concerned about this a week or so ago. There was a lot of anxiety regarding that very tragic death and whether or not we were going to see an overrepresentation amongst younger people. That hasn't transpired. We've had no children in the ICU at the Women's and Children's Hospital so far. Yesterday, we saw 19,163 tests which were undertaken in South Australia, and a further very significant reduction in the lab time in South Australia. It's now down to around about 11.4 hours, so a further 3-hour reduction through our laboratory. That doesn't mean people are getting theirs, because it takes time to take the swab, collate those and send them to the lab, but what we're seeing is that lab time is extraordinarily quick at the moment, and so congratulations again to SA Pathology and the private labs who are in South Australia who are doing a fantastic job. We have had a further slight uptick in the number of SA Health staff who have COVID, so we now have 308 SA Health staff. So this includes the South Australian Ambulance Service who have contracted COVID, and so obviously this is something that we're keeping a very watchful eye on at the moment. I can also report to you that vaccinations yesterday ticked up again. So I've got to say a massive thank you to everybody who has done that. I think yesterday was 19,998 in South Australia, and very pleasingly about 15,500 of those were boosters. But I still want more, and tomorrow I'll be doing a press conference with Professor Spurrier, and we'll be talking about some additional capacity that we are going to be putting in to, if you like, ramp up the availability of vaccinations and boosters here in South Australia. It is still the very best thing that you can be doing this year, is to go out and to get that booster, get that vaccination. I'm very pleased to see some people having their first shots yesterday, almost 1,000 people. I think about 1,500 people having their second shots in South Australia. This is really good news in South Australia. I'm very pleased that that people are taking this Omicron variant particularly seriously. I've now got to talk just a little bit about the rapid antigen test changes that came out of the National Cabinet yesterday. So what we decided unanimously across all jurisdictions present at the meeting is that we would use a positive on the rapid antigen test as an alternative to getting a PCR positive. So in the coming days, as I said yesterday, we'll be outlining exactly how this is going to occur, and I can tell you more about this today. In fact, I've just come from a meeting, the COVID Ready Committee meeting, where we went through some detailed preparations that are already in place so that this can be rolled out in South Australia. People who are close contacts need to identify or be identified by SA Health. They will then be sent a QR code that they can go and collect an SA Health rapid antigen test. In fact, they will receive 2 of them, one for day 1, one for day 6. If they get a positive on the day 1, they will be deemed to be COVID positive. No need for a corresponding PCR test. So this will reduce the pressure on our PCR tests in South Australia. It's about 95% accurate, and the whole country yesterday agreed that this was the best use of our finite PCR testing capability across the state. So all the work is being done at the moment within SA Pathology, within IT, within the Department of Premier and Cabinet, and also SA Police. In fact, the State Emergency Centre will be setting up the collection points across South Australia. It's a huge logistical exercise. It is quite a change from where we were some time ago, but this is the appropriate response for this part of the disease. But I emphasise this needs to be an SA Health rapid antigen test. We don't want to deplete those that are available in the general public. So you'll need to identify yourself, get that QR code, go and collect the 2 rapid antigen tests, administer them, and then of course feed that data into our system. Now we want it fed into our system because we want to have the very best data possible so that we can continue to really closely monitor this disease in South Australia. So that's the general information I'm providing today, and I'm very happy to answer any specific questions.
That system, has that already been set up for GPs and pharmacies to upload that information?
So that will be through our SA pathology, so it will be a standalone system. So people that consider themselves to be close contacts will need to go on, get that QR code, then go and collect their rapid antigen test. So we're not encouraging people to buy from pharmacies or from supermarkets and administer it themselves if they're a close contact. We want to leave those for people who want to do surveillance, but in terms of those people who are designated close contacts doing their 7 days of isolation, they currently need a test on day 1 and day 6, which is a PCR test. We're just now making it clear that in a few days' time, certainly within the next week, we will move all of those over to rapid antigen tests, provided free by the state government.
Will there be follow-up to make sure that people are reporting back? So if they test positive and they don't want to report it back, that is happening?
Well, of course, when they receive that free test, they're then entered into our system, so we will be able to follow that up.
And will you then be reporting them as well? I guess at
Yes.
the moment, do you think today we saw a reduction in cases because fewer people are getting tested?
No, in fact, I think, as I said yesterday, I think demand and supply are pretty much in equilibrium in South Australia. Certainly this morning at the 9 o'clock update, I looked through the entire list of testing sites, and most of them were within 1 or 2 hours, which is fantastic. The outlier was Mount Gambier. We have seen a lot of people that have been holidaying down in the southeast, in particular around Robe, who are going into Mount Gambier. That's why, as of today, we've now set up a new site, a dedicated site at Robe, so that those people are not needing to go into Mount Gambier for that testing.
How confident are you that these tests, the rapid antigen tests, are reliable? We've been contacted by someone who said they took a PCR test, it was positive, and they took a rapid antigen test out of curiosity, and that came back as negative. How confident are you that these are actually giving you
Look, there's no doubt that the PCR test is more sensitive, especially in the early or the latter stages. But what we know from the clinicians is there's about a 95% confidence. So if you get a positive on the RAT test, you're definitely going to get a positive on the PCR. And of course, if we do the test on day 1 and then again on day 6, we believe at this stage of the overall disease that is sufficient for protecting the population.
You mentioned that it has to be an SA Health rapid antigen test. Is that because they are more reliable than the tests that we can get in pharmacies?
Well, there's 2 reasons. One, because we have a high confidence level with regards to the quality of the rapid antigen test. We know where we've purchased them from. Secondly, they'll be free to the user. And I suppose the third thing is that then they're entered into our system. So we really want to make sure that we are reporting the full case in South Australia. That's difficult if people are just doing the test, self-diagnosing, isolating, but we're not feeding that into our data. So it's really important that we get that data right. And of course, we know that the vast majority of people in South Australia who are COVID positive won't develop debilitating symptoms. But about 0.5% at the moment are ending up in hospital, and about 0.5% are ending up in the medi-hotels. The vast majority of other people can be using our COVID hotline for support. And if they're in the system, we're in a much better position to offer all of those separate options to them if their condition deteriorates.
Where do people get the SA Health test? Is it from the testing sites, or is it from pharmacies, or is it from both?
So I met with the Police Commissioner today via Zoom, and he told me that he's in the final stages of identifying where those collection points will be. It is a big logistical sort of exercise because it's not just metropolitan Adelaide. This has got to be the entire state, and getting those rapid antigen tests to people quickly. So we'll be in a position in the next day or so to be able to identify exactly where those sites are. Now, some states said that they might do them at the existing PCR testing sites, and some states are completely separate. We're just going through that exercise at the moment. Should have good advice in the coming days.
The policy's in place today, yet you don't know where people can collect them today.
No, it's not in place today, sorry. I'm just giving advice, as I did yesterday, that it will be in place within the next 7 days.
You mentioned that there are now in excess of 300 SA Health staff who have tested positive to COVID. How concerned are you about the workforce, not just within SA Health, but other essential workers, because of course it's not just people that are testing positive, also who are now having to go in isolation. We're seeing short supply of SA Health staff, of transport workers, of supermarket workers, that kind of thing.
Yeah, look, you're 100% right. We are battling two issues at the moment. One is we're not wanting too many people to end up in hospital, so we're wanting to slow the spread. But we've also got to make sure that we maintain a workforce to support those people who are ill at the moment. So it's a very fine balancing act. In total in South Australia across SA Health, we have 573 staff who can't go to work. So 308 are positive and the rest are furloughed. But as I said at the previous press conferences, a lot of those furloughed staff can work remotely from home and support those people who are living with COVID in the community. So they become part of that COVID response care team, what we call the cricket team, and they can do that remotely from home. So they're not completely lost to the overall system, but every single health system in the country at the moment is worried about the loss of employees. This is one of the reasons why we have higher level settings in South Australia in terms of that isolation, and we have a longer time that people are in isolation if they're COVID positive in South Australia. Trying to get the balance right is very difficult, but I think at the moment in South Australia we've got it about right. We have, as I said, at the moment we have 123 people in hospital. This is well within our capacity. We will still see those numbers increase. Certainly the forecast that we're starting to look at again now is showing that we are going to see increasing cases in South Australia, but what we're trying to do is to slow that spread so that it doesn't overwhelm our health system and it doesn't take out our entire health workforce.
Just understands that Salin is sending out text messages to people asking them to come back from leave because they're so understaffed. Is that appropriate?
Yeah, I think at the moment, it's all hands on deck. We are trying to get as many people with health qualifications into the system. We're trying to bring people back who might have retired, people who still have qualifications to help in vaccination clinics, to help in our testing laboratories. We've seen massive shortages interstate, and we have seen testing times massively blowing out. I know that our times here have increased, but what we've seen in the last 3 days is those numbers come down, which is absolutely fantastic. And there's a very cooperative health workforce in South Australia, both current and past, that are all wanting to get in, do the work and keep South Australia protected. Stacey? Oh, sorry. I thought she was just going before then, Jodie,
no,
sorry.
That's all right. We'll share, it's okay. On the hospital at home, we've had reports from people who work in the health sector that they've tested positive or their family members have tested positive and they're yet to receive any contact from SA Health 4 or 5 days later. And they're quite worried about how they're meant to care for their loved one in the appropriate circumstances. Is that appropriate that they haven't received any contact from SA Health despite being positive for 4 or 5 days? And what should they do?
Yeah, no, definitely get on the COVID hotline, which is available 24/7. Sometimes we find that the number that somebody put on their original application is a home number that they're not answering. They've put in their landline or they've just given an incorrect number, and it's very difficult for us to trace those. So if anybody hasn't been contacted, get on the hotline and make sure that you can update the details so that we can keep track. Look, the vast majority of people do not need support, and some people that are calling for support are there for 2 or 3 days in support from home and then move out of the system. We've got a large number of people that are supporting those people living with COVID at the moment. The cricket team is doing an absolutely fantastic job. If you haven't been contacted, please get in contact with us. We'd love to hear from you.
We've heard a story this morning about an 85-year-old woman. Sorry, Jodie, you go.
No, you're fine.
An 85-year-old woman who has emphysema who was sent away from the hospital despite having COVID and having these underlying conditions. What do you say to that?
Well, look, ultimately, this is a decision which is made by clinicians, not made by politicians. The vast majority of people are cared for at home. In fact, 99% plus of people who have got COVID are in their own home or in the Medi-Hotel, not in hospitals. And that's just a fact of this Omicron variant. So that's absolutely fantastic news. And of course, most patients want to be looked after at home, not in a hospital setting, away from their comforts. But ultimately, those decisions are made between the patient and the clinicians, certainly not by politicians.
I guess
Jodie.
a lot of nurses feeling overworked at the moment and really, really stretched. What's your message to them?
Well, the nurses in South Australia have been an absolute hero, or been our heroes since day one. They've done an absolutely fantastic, along with our doctors and along with our ambulance officers in South Australia. We're very grateful for their incredible work. They've been on the front line. They've been doing it extraordinarily well, and I think all South Australians should be very proud of them.
Today, the Prime Minister said that yesterday at National Cabinet, all the premiers agreed that school will return, that students will return to school on the first day of term. Is that something you agreed to, and can you make that commitment to parents?
So we're really keen to get students back to school because we know that face-to-face learning is optimal. We want to do it in a safe way, safe for students and safe for teachers. And what was agreed yesterday at the National Cabinet is that we would set up a working group, each state putting a representative on so that we could have a national approach if possible. We still don't have any final advice, but certainly I would love it, and I think a lot of parents would love it if their students went back day one, term one, but I think it's still too early to say in South Australia.
So was he a bit too excited about that? He said every premier agreed that students will go back on the first day of term one.
I think we're certainly all in agreement that we would love to see that happen, but it's still a little bit early. We haven't reached the peak of Omicron in South Australia. In fact, I don't think any state's got anywhere near the peak. We saw big increases today, again, in many other states around the country. I think we're a long way off, I think we're weeks off the peak, and we really need to get that data in before we can say emphatically that all students will be back day one, term one.
And so just on that, what will it take for you to give parents the answer? Because it is only a few weeks away. So are you waiting for health advice? What is it?
Yeah, so what we've asked the Education Department to do is to look at all options. So we've got all scenarios now mapped out, whether that be home learning, whether it be school-based learning, or a combination of the two. And we also need to look at the age groups of those children. Now, obviously, those 12 and above have had the opportunity to have their vaccination, and I'm very pleased to see that there is increasing vaccination amongst those 12 to 17-year-olds that I was calling out yesterday, so thank you very much. But obviously for the 5 to 11-year-olds, those people in primary school and also those people in early learning centres, they're not going to be fully vaccinated by the time that the school goes back. So we need that advice. You know that about a week ago we were concerned in South Australia with that tragic death of the child under the age of 2. So we've been looking at that very carefully. Very thankfully, we haven't seen an escalation or repeats of that around the country. And we certainly have seen a very flat line admission profile for those people at the Women's and Children's Hospital, and yet to date, not a single child has gone into ICU. But we're looking at those numbers very carefully, and we do want to update the parents as quickly as possible. We just need a few more days to be able to get that final data in.
What's the state government doing to try and ensure that all children between the ages of 5 and 11 can get at least one dose before they return to school, should they actually return to school on the first day of term one?
Yeah, we're really keen to get as many 5 to 11-year-olds with at least one dose of the vaccine in their arm before they go back to school. We know this is a great level of protection in terms of catching the disease, transmitting the disease, but most importantly on reducing the symptoms of Omicron. Now we have already got a large number of people booked in, and those jabs start from the 10th of January. But we're also keen to open up more capacity, and we'll have more to say about that tomorrow and over the coming days.
You mentioned on radio this morning that you might be getting some modelling and forecasting about the peak of this outbreak and how many cases we could expect and when that might happen. Is there anything else you're able to tell us about that?
We had an interim meeting this morning where we looked at the first cut of a new forecast for South Australia. Hopefully we've got something more to update you on next week. What we are starting to see in South Australia is a slowing of the new cases, which is really positive. I don't want to jump the gun here because it's still early days, but the additional restrictions that we put in on the 26th of December seem to have slowed it when other states are still accelerating. We know that there is going to be a peak. We are still reasonably confident that will be before the end of this month. We don't have a final number, but hopefully next week we'll be able to provide further detail. The good thing is that when we look at the trajectory at the moment, it seems to be improving, not getting worse like it is in many other states.
Do you think we've hit the peak, given our numbers are down today?
No, I don't think we have. I think that the numbers are going to jump around. But what we are looking at now is the doubling rate. I think South Australia has the slowest doubling rate in the country, and I think we have the lowest reproduction rate in the country. Now, it's still worrying. I've got to be clear. We're not out of the woods by a long way. We haven't hit the peak. but there are lots of green shoots, signs that the restrictions that we put in place on the 26th of December have helped us to avoid a disaster like we're seeing in plenty of other places around the country and around the world.
When we talk about the peak, can you give us any indication of what we might be talking about? 10,000, less, more?
Yeah, look, I'm hopeful that I can provide some further detail on that next week. Certainly, we're going to see an escalation from where we are at the moment, 3,500. We're going to see that increase. In some other states, that is really doubling every 2 to 3 days. In South Australia, it's doubling far more slowly, but we are going to see more cases. But the good news is we're also seeing, because of the high vaccination rate in South Australia, less than 1% of people that are ending up in our hospital settings, and that's great news. And that's one of the reasons my strong advice is vaccinate, 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 get those boosters, get those jabs into the arms, and that's what we'll be talking about virtually every day from now on. And we'll certainly be opening up additional capacity so that people who haven't been able to get an appointment yet can go and have that jab. And look, at the moment, there are still a huge number of appointments remaining for the rest of this month. Some people will say, look, I looked 3 days ago, couldn't find one. Go on again today, because we're putting thousands of additional appointments into the model on a very regular basis. And you know, I've heard of people booking in the morning, finding one that afternoon, and that's exactly what they should be doing.
And when you do get the model in, will you release that?
Yes. So we did that last time, and we'll do it again. It's just that it does vary around a little bit at the moment because you've got a model, which was the original Doherty model. What we're feeding in now is actuals and trying to understand what that reduction in the transmission potential is from the decisions that were made on the 26th. Unfortunately, if we didn't do anything on the 26th, we were heading in completely the wrong direction here in South Australia. We've been able to slow that curve. I hope that the peak is much lower from where it was projected to be. Certainly the early signs are that we're on the right track.
Just on rats, what's the supply chain look like? How many have we secured? How many have we got coming in daily, weekly, monthly?
Yep. So South Australia has secured more than 10 million, which compares very favourably with any other state per capita, and we've got about a million coming in per week. And so we know that we've got the adequate supplies to make sure that we can move to this new arrangement where SA Health will be providing free rat tests to those people who are close contact. So this is a shift, it's a pivot, it's the appropriate time for us to be making this pivot, and it certainly was agreed unanimously yesterday at the National Cabinet.
And so before the policy comes in over the next 7 days
Yep.
or so, you said, so in the interim, where do people get?
Still PCR, and as I said yesterday, the waiting times are coming down for PCR, and also the time through the lab is massively coming through in South Australia. We have a very different situation than some other states. We saw in the paper yesterday, I think, that in one state they were waiting 5 days for a response. In South Australia, it's hovering probably around 24 hours, and it's coming down, which is really good. So, and the private pathology labs in South Australia are also catching up, which is absolutely fantastic.
So today, if I'm a close contact, I get a rapid antigen test. I still need to go get a PCR until it comes into place.
If you're a close contact, we're asking you to go and have a PCR test.
Still for the next 7 days.
So not a rat test at the moment. So that will come in down the track. But as of today, close contacts need to isolate for 7 days, and they need to have a PCR test day 1 and day 6. And then, of course, we'll be moving to this new arrangement very soon.
Yesterday's press conference was a little bit spicy as you were leaving. Is that indicative of how frustrated people are feeling, and also do you have a message for the lovely security man who jumped to your test?
Look, I'm also always very grateful to SAPOL. They do a fantastic job looking after our entire state. Yesterday, I needed a little bit of help, and I was very grateful that they were on hand.
And just on the foster and kinship carers inquiry,
Yes.
they're up in arms, they tell us, because the person leading the inquiry is not independent. Would you still call it an independent inquiry?
Look, I would. I think Dr. Fiona Arney has got an incredible reputation. She's nationally and internationally regarded in child protection. We're very serious about improving child protection outcomes in South Australia. We have been since we came to government. We have a dedicated minister for child protection. We've just announced big increases to payments to foster carers in South Australia. When we came to government, child protection was a mess. There's no two ways about that. There was a massive inquiry that the previous government had to have into their own management of child protection. We're working through all of that, but I think it is time to have an independent inquiry, and Dr. Fiona Arney is exceptionally qualified for that task.
Can you assure them, though, that they will be heard this time?
I can give my absolute assurance that all of those people, the foster carers, the kinship carers in South Australia, will be listened to by an independent person. Dr. Fiona Arney is absolutely outstanding. We're very grateful to our foster carers and to our kinship carers in South Australia. They've done an outstanding job. We've managed to significantly increase the number of foster carers and kinship carers in South Australia since coming to government. We've increased the payments to those foster carer and kinship carers from the age of 18 up to 21 now for those people in their care for the first time. I think we were the first jurisdiction in Australia to do that, and most recently we've announced an increase, a fortnightly increase to those people that are helping out with some of our most vulnerable children in South Australia.
Great, thanks everybody.
Thank you.
I'm